Hi, my name is Dr. Kanna Vela, and I'm an emergency physician at the Scarborough Health Network and Lakeridge Health Corporation. I'm also a lecturer at the University of Toronto Department of Community and Family Medicine, where I help train and teach medical students and residents through their rotation. I'm also currently the EPIC Champion Lead at Lakeridge Health Corporation, where I've been involved in implementing a new electronic medical health record system in our hospitals. Since March 2020, I have been working in our emergency departments, COVID assessment clinics, and COVID vaccination sites to help fight this ongoing pandemic. It has been stressful and exhausting mentally and physically. At the beginning of the pandemic, I made the very difficult decision to move out of my home for 2 months to reduce the risk of bringing the infection home to my family. This was when we knew very little about the virus, how it spread, and how to treat it. When I moved back home, it was just as difficult because I was constantly plagued with the guilt of possibly passing on the virus to my loved ones without knowing it. I was also involved in helping to coordinate food donations to frontline workers in our hospitals through Inforce Foundation and many Tamil businesses who stepped up during the few waves to support us. In the last 2 waves, the Scarborough Health Network was treating the most number of ICU patients in the country, many of whom were from our Tamil community. I've been involved in a lot of community outreach, especially in the Tamil community, through media outlets and organizations like the Tamil Civic Action to help educate families and navigate people through the pandemic safely. This current wave is much different from the others for many reasons. Our new dominant variant, the Omicron, takes up approximately 90% of new cases. It spreads much faster and much easier than the other variants, and case counts are doubling every 3 days. You can catch and spread Omicron variant even if you are vaccinated. We are starting to see a rise in hospitalizations. Many people have a lot of questions about this new variant and what it means for the future. We currently don't have all the answers, but I will share with you what we know so far. First, the vaccines still work. If you are young and healthy and have had at least 2 doses of an mRNA COVID-19 vaccine, that is Moderna or Pfizer, you will probably be fine. You may get COVID-19 infection, but it is unlikely you will end up very sick, needing to be hospitalized or die. Secondly, if you are over 50 or have other medical illnesses, such as asthma, heart disease, diabetes, cancer, or other illnesses that affect your immune system, you're at higher risk in getting sick with COVID-19, just like the other waves and variants, and having a 3rd booster will definitely reduce those risks. Many have asked the question, why should I vaccinate my children if COVID-19 usually doesn't make them very sick and they'll likely be fine? The reason is that children spread COVID-19 to others who won't be fine if they get infected, like their parents or grandparents or loved ones. And in fact, prior to the holidays, more than 1/3 of new cases were through school transmission. We also have some children, although not very common, become very sick and die with COVID-19 infection, and some of them did not have any health issues prior to getting infected. The vaccines are safe in children, and millions around the world have been already gotten 1 or 2 doses of Pfizer or Moderna, and there have been very little side effects. My daughter is 6 years old, and she got her first dose a few weeks ago and will be getting her next one in a couple of weeks. And my second daughter will be getting her first dose when she is eligible in the new year. I know that everyone is tired of all the restrictions. I can appreciate they miss their old lives and being able to have social gatherings and interact with people the way they used to. Ontarians have done remarkably well through this pandemic by following public health guidelines and getting vaccinated. We were all optimistic and hopeful about a more normal 2022, but this new variant has changed those plans drastically. There is still hope that we can get through this. It is a lot to ask, but the outcome of the next few months and year will depend completely on what we do the next few weeks. If we vaccinate all the children, get as many people as we can to get their third boosters, and limit social gatherings, continue masking and social distancing, we can get out of this wave with very little hospitalizations and deaths. We have canceled all our family gatherings this holiday season to help reduce the spread of this new variant. However, if we fail to do this, our hospitals will become completely full and be unable to treat sick people who need care. Businesses will continue to shut down and close, and the children won't be able to go back to in-person learning. So please do your part this holiday season. Get vaccinated if you haven't gotten already. Stay home unless it's necessary to go out, and continue to mask and social distance. Thank you to the Tamil Civic Action for allowing me to say a few words. Thank you.